and some communities look like they've been left to their fate when they are thousands of kilometers away from the state capitals or the city centers. And lastly, I also want you to strengthen the health system reforms that you've said that you're going to do. A lot of people are really counting on you because you're a visionary leader, and we help to strengthen the capacity of our hospitals. Some of them, once you go out of the federal tertiary institutions or medical facilities, our states are really not having it very well. The investments in the health sector is very poor by the states. So what are the subnationals doing to strengthen health investment and health system reforms? Thank you, sir.
Okay, the man there, yeah. No, please. The man at the back with cap, please.
Good afternoon, sirs. Daily Anof is my name, and with the Nation newspapers. Sir, there's so much movement in the health sector with all the reforms and programs going on, but then the social welfare part of your ministry, there seems to be almost nothing happening. What could be the challenge, sir?
Honorable Minister, maybe we'll just take the first three questions. Maybe you may, so that we don't lose focus, please. No, you have a microphone there.
Very good. Well, thank you. I think all these questions, I would say, are excellent questions. And let me try to respond to them one by one. On the human resources and the training of health workforce, that's a major agenda for this administration. And in fact, some of what we had started doing was noticed by the Bureau of Heads of States of the Africa Union. And as you recall, 2 weeks ago at the Africa Union, they appointed His Excellency President Bola Ahmed Tinubu as the Africa Union champion on human resources for health and community health delivery, because it stands out what his administration is doing across sectors, but with a focus on the human resources. In addition to expansion of training, but also try to streamline the processes for retaining those who have been trained. You also recall his decision whereby we streamline and be more efficient in terms of the waivers for recruitment of health workers in particular. That is an exception. In addition to ensuring the health regulatory bodies, the professional regulatory bodies are funded as well, which is an exception. Particularly on the internships, which is within our remit. With the MDCN, we're working to operationalize an electronic matching system. Let me explain to you what it is. So take a large country like the United States, which is several folds, has more physicians, more population, but they do matching of their interns and residents electronically on a single day. Residents that are graduating get matched. You don't have to lobby anyone so long as you are qualified. So we're working with the MDCN to ensure that we streamline the way of matching so that an intern doesn't have to lobby anyone or to bribe anyone or to beg anyone. Intern is a trainee still before they get to your service. But this has not been done for a long time, and this administration is trying to move the needle so that we make it easier for our young ones. We met with many professionals who were trained outside this country, who had to be vetted, because health sector is one sector where you don't want a poorly trained provider or somebody who doesn't meet up the standard. I'm sure in this room, nobody will want to be treated by a doctor who doesn't really know his left from his right. I'm not saying that this is the majority, but you never know. And the role of the Medical and Dental Council is to vet, to ensure that those who are licensed, even provisionally, are competent enough to provide safe and effective service to Nigerians. I think, so I would say that we're working on that, and you should see steady progress, especially with the new leadership of the Medical and Dental Council of Nigeria. The question of medical industrialization, if I can just explain, there's a value chain in health. We have not tapped it. Health as a part of our GDP accounts for less than 4%, which is half of what it should be. In many countries, it's much larger. and it's been ad hoc. We've allowed ourselves to just import things, pharmaceuticals, 100% of our devices, and many things. So what are we doing? There are aspects that have to do with policy. The fact that we're prioritizing local manufacturing and looking at fiscal policy measures. So reducing barriers for importing raw materials or equipment so that those who are manufacturing here can be able to, can be able to manufacture, streamlining the regulations, and NAFDAC is here so that we simplify the processes that manufacturers will need to follow to get to manufacture locally. And then enforcing the 5+5 and reviewing it, in fact, so that if you import, after a while, you lose the opportunity to import. You have to manufacture so that we're not perpetually dependent on imports from outside. And then pulling of what government will buy to prioritize domestic manufacturers. There's an executive order already that allows for a premium for locally manufactured products so that we patronize what is produced in Nigeria. At the end of the day, some of the products that are being imported, believe you me, we're just paying large amounts of money for the brands because we, as Nigerians, had made a choice. We don't like what is ours. We like what is imported or produced elsewhere. That mindset shift has to occur. And the regulatory bodies, we've been really working hard with NAFDAC and PCN and others to ensure that once we approve that things that are produced here are safe and effective for use, Nigerians can patronize them. That is how we can revive the industry. Thirdly, on financing, it's not public sector finance to private sector, but mobilizing the private sector resources so that financially viable, market-tested investments can be supported. And the Afrexim Bank MOU, and there are others. I mentioned the $240 million investment approved by a company from Brazil to manufacture locally. But there are also local manufacturers that are working towards expanding their pipelines to produce certain lines of antibiotics in Nigeria. And then the supply chain itself to be defragmented. Over the last weekend, I was in Kano. I saw the coordinated warehouse complex that was built in Kano State. Because if you don't have a control of your warehouse, of your supply chain, all kinds of counterfeits can get into the market and they will undercut the local manufacturers. And we have many of those because until now, the supply chain for medical commodities, anybody can buy stuff, import them, and sell it to people. So those are the measures that government is doing. But there are things that the private sector itself will have to do, which is organizing itself better, being strategic in terms of the niche they want to play, and to compete with the support that government will be providing them to compete favorably in the market without creating unnecessary distortions. And we see the private sector as very, very important partner. I think the president has said it repeatedly that Nigeria is open for business, but we say in the health sector that the health sector is also open for business, but also laser focused to ensure that the public mission is not undermined, that the private sector participates, but that the public mission, that we don't leave some Nigerians behind, that we provide what is necessary to protect the health of everyone, even as the private sector invests and contributes in a complementary manner to what the federal government is doing. The disease control question on surveillance in Hartreach, we have one of the best surveillance systems, for instance, for polio eradication. And we're deploying that for many other diseases. And you hear the outbreaks of this or that, because there's a very good network of surveillance in this country. Any child that has flaccid paralysis that is acute will have stool tested, and within certain hours will have to get to a lab, and that will be tested. And the viruses identified are fingerprinted. These are behind the scenes. These are the measures that we have put in place to know that when there's an outbreak in Nigeria, that we get to know it quickly and it gets reported, whether it's measles, whether it's the cases in Kaduna, whether, like I told you earlier, meningitis, or whether it's AFP for whatever reason for the mutant polio viruses. We've trained epidemiologists through a program hosted at the NCDC. There have been thousands of Nigerian epidemiologists. They're among the best in Africa. In fact, the Africa Center for Disease Control is complementing Nigeria, because when there are crises, other countries, either in the sub-region or in Africa, Nigerian epidemiologists get called to actually go and respond, because we have had a very vibrant training for those epidemiologists. I mentioned that in November we approved a resolution at Council on Health to have state public health emergency operation centers. At the federal government, we have those emergency operation centers, MPHCD as well as NCDC, and in some states. But we're asking state governments to establish their own public health emergency operation centers. And where there are gaps, federal government is willing to step in so that outbreaks can be stopped before they spread to other states, before we get a pandemic. Because a pandemic or epidemic starts from an outbreak. Our idea is to prevent these diseases before they spread. So it's still very much work in progress, but we're focused on it as part of the health security pillar of this administration. The hospital situation, I have to say, in the last few months that we've been in office, both my colleague, the Minister of State, and myself, we've visited many hospitals. And we're very impressed with what the federal teaching hospitals, the tertiary hospitals are doing. Many of them, in fact, this is some of the, let's say, the perception gap. People travel abroad, but there are some of our hospitals doing amazing things. Teaching hospital in Zaria yesterday did a very complicated urological surgery, transplants, many other interventions that are happening. But the state governments, I think, have, in a way, not invested as much in the secondary facilities. But as part of the compact that we signed in December, witnessed by the President, we asked them to invest more in their health infrastructure as well, to complement what the federal government is doing. On the social welfare question, the gentleman asked the social welfare part of the ministry. Well, as you know, it's constitutional. Government, social welfare is one of the key expectations on government, and this administration put it front and center. But it's a cross-sectoral, whole-of-government effort. We take the approach, the welfare of Nigerians, there are several intersections to the welfare of Nigerians, whether from the adolescent girl and the young woman, and the work of the Ministry of Women's Affairs is very important in that social welfare agenda. The work of health in basic maternal, newborn, and child health is really touching to the welfare of Nigerians. When I said hundreds of thousands of women access antenatal care, get skilled birth attendants, that is really to the welfare of Nigerians. Whether it's expanding the Vulnerable Groups Fund, that's financial protection for Nigerians. Whether it's the intersection with education, whether it's the intersection with some of the interventions on social investments, some of which the Honourable Minister has touched upon, and whether it's on aging and taking care of our aged population. Specifically in the Federal Ministry of Health and Social Welfare, we've developed the concept of a social action fund, and His Excellency Mr. President has approved it. It's in the corrigendum that we're expecting from the National Assembly. What is a social action fund? It's a way of supporting communities to address their needs, so that we're not determining from the federal government, from Abuja, what a community out there is prioritizing, but that they have transfers in collaboration with the states and local governments so that they can relieve those constraints, in a way trusting those community-based systems to function, to address the priorities of Nigerians. Because the convention is, it's always easier to spend on large items, big roads, big buildings, multi-billion-dollar projects. And yes, those are necessary for growth. But the problems in many of our communities are very small. Some communities need a protected well to have clean water. Some just need a roof over their primary health care center. And how do we get that? And those are not things that are, let's say, conventional, but this administration is developing this concept of social action funds to be able to address that, but to do that in partnership with the states, with also some of the development partners, so that we begin to also respond to the needs of Nigerians to build the social capital that is inherent in our communities, so that people will feel the impact of the wider reforms. And the minister mentioned some of the economic growth that is being pursued, and we're seeing progress in that line. So thank you. I'll stop here.
Thank you very much, the Coordinating Minister for Health and Social Welfare. Okay, you are still raising your hands. Okay, beautiful. Before we take another round of questions, we should allow the Honorable Minister to take water, because they said water is life. Please. Thank you. So let's see your hands. 1, 2, 3, 4. We end it there. So please give the mic to my number 1 person in the front, please.
The Honorable Minister, some of your predecessors embarked on a very massive project, that's revitalization of over 1,000 basic health clinics nationwide. Can you give us a status update on these basic health clinics and what has become of the project? Thank you.
Honorable Minister, sir, my name is Yakin Akinwale. I'm the Deputy Editor at the Cable Online newspaper. Between 2016 and 2018, over 9,000 medical doctors were reported to have migrated abroad. And you said in your speech that in the last 6 months, the government recruited 2,497 health workers, including medical doctors. In the face of mass exodus of medical doctors, do you think Nigeria has enough medical doctors to take care of our health need? Thank you.
Honorable Minister, my name is Sonny Daniel. I work with Vanguard newspaper. I don't really, if you don't have an answer to give me, it does not matter, but take note of the few issues which are still struggling with health care delivery in Nigeria. You may wish to take a look and see what can be done, because when you left Gavi and came to Nigeria to work as the coordinating Minister for Health and Social Welfare, there is a very high expectation by Nigerians that certainly this type of a person will leave a mark. Number one, you may wish to take a tour privately. Don't make noise about it when you are going to hospitals. For instance, go to the national hospitals and see how they are treating Nigerians, and see for yourself, because if you make an announcement, everything will be all right by the time you visit. And you can also go to other tertiary institutions in Nigeria and see whether what you are expecting as a renowned health professional is what they are giving to Nigerians, given the facilities we have. Again, in this country, it is a taboo for doctors, nurses to attend to gunshot victims. It's still a taboo. Even though if you ask the IG, he will tell you he has given instruction. Can Nigeria not have a policy to treat gunshot victims, whether they are the assassins or victims? When they have recovered, they can be sent to court for trial, so that life are saved first. Again, where you came from, drugs are readily made available at affordable prices to the people. How are we suffering like this? The cost of drugs have reached the rooftop. And what can you do to bring down the cost? At the same time, Nigeria is a country where people can easily go and produce fake drugs and bring here and sell. How do we close the routes so that what we see and buy is nothing but genuine drugs that can save life? And finally, so that I don't behave as if I'm dictating to you, when people are said to have cancer in Nigeria, everybody will begin to stigmatize and begin to sympathize. How do we make it possible that if somebody is diagnosed of cancer, there is a chance, there is hope that the person would recover? Thank you very much. You don't need to give me an answer, but think about them. Thank you.
Okay. That's the last one for the day, please.
My name is Tony Ezimak. I work with independent newspapers. Honorable Minister, there have been reported cases of mental health challenges, especially among young children since after COVID. This has been on the rise. Anxiety disorder, moderate to severe cases of psychological issues among young children. I don't know whether you have this information from the various hospitals, and if you do, what is being done to address this aspect of the health of the nation? My colleague has taken the last question, which has to do with the skyrocketing cost of drugs and basic medicines. What is being done to address it now?
Please take the microphone to the first speaker. People said you did not introduce yourself, please.
Honorable Minister, I'm Yusuf Ali, Managing Editor, Northern Operation for The Nation newspaper.
Honorable Minister, you may please wish to respond to all the questions. Thank you.
Yes, thank you. I managed to get some water, and I think my throat is a lot clearer now. So I think the first question on the basic healthcare revitalization. There are 3,600 or so primary healthcare centers that had been upgraded over the last several years, out of 8,800 that are receiving direct facility financing from BHCPF. We are going to make those outstanding ones functional and expand the facilities to 17,000, because we had to take a baseline of where we are, because the Basic Healthcare Provision Fund is meant to provide resources to make them functional to serve Nigerians. And we've said that repeatedly.